Acknowledging the traditional owners of this land and Pacific Caucus honors and pay respect to our elders and our ancestors. The Pacific Caucus wishes to report on the status of education for the native Hawaiian children and youth, especially with regards to Article 12 to 16 and other articles of the United Youth of the URDR. Although native Hawaiian children and youth comprise 40% of the state's of Hawaiian public school system, only 1% of those children and youth are afforded access to Hawaiian immersion schools in the land of their ancestors, and only 1% of the state's of Hawaii development of education annual budget of $2.2 billion is spent on 80 native Hawaiian education programs. This is having a severe impact on the maintenance of native Hawaiian identity and culture into the next generation and amounts to cultural genocide. Many of the 99% of native Hawaiian children not in Hawaiian immersion schools cannot even pronounce their own Hawaiian names correctly, and native Hawaiian youth in their secondary schools have the highest dropout rates of any ethnicity, as language is the basis for any cultural identity. This lack of support for native Hawaiian language, culture, and identity by the states is a grievous human rights abuse. Recommendations. Hawaii. 1. That the permanent forum called upon the United Nations Special Rapporteur on Human Rights and Indigenous Issues to visit Hawaii to investigate this alarming issue of lack of adequate native Hawaiian education, as well as many of other human rights abuses being suffered by native Hawaiian people at the hands of the American government. 2. That the permanent forum called upon the United States and its agency, the state of Hawaii, through the Department of Education, to provide adequate funding and a long-range plan for increasing the 1% of native Hawaiian children and youth in Hawaiian immersion schools from 1% to 10% in the next 10 years. Such a plan should include a native Hawaiian Board of Education governing native Hawaiian schools and 40% of the current state of Hawaiian development of the education budgets of $2.2 billion annually be allocated to native Hawaiian education. Madam Chair, the Suicide Story Aboriginal Advisory Group is an essential component of the program success. It was originally missing from the original design, but was factored in based on community recommendations. We make the following recommendations to the Permanent Forum. 1. That all states ensure that Indigenous suicide prevention programs maintain a strong cultural advisory group to ensure cultural safety throughout program development and implementation. 2. That all states ensure that all Indigenous prevention program contents is developed through the teachings and guidance of Indigenous peoples and centers on the specifics of Aboriginal protocols and suicide. 3. That all states ensure that prevention programs are grounded in both-way learning to ensure Indigenous people have a comprehensive set of skills and tools. 4. That all states ensure that program development for Indigenous people always use a community approach to create the interactive program model that uses Indigenous community solutions supported by service providers for an effective suicide prevention strategy. The National Aboriginal Community Control Health Organization recommends that 1. All states to fund and deliver training in suicide prevention and mental health awareness to all teaching and non-teaching staff in all Indigenous schools. This will include the worldwide recognized programs such as Applied Suicide and Prevention Schools Training and Mental Health First Aid. These programs should also encourage the development of localized, culturally appropriate training programs. 2. All states to ensure that training for teaching and non-teaching staff on suicide prevention and mental health is incorporated into 2 entry levels of training and ongoing staff training. 3. All states to build the participation of Aboriginal and peoples in the workforce in fields related to suicide prevention, early intervention in social and emotional well-being through provision of training, skills, and professional qualifications at all levels. 4. All states' Aboriginal population are supported within available resources to respond to all levels of suicide and self-harming behavior with effective prevention strategies within their communities. 5. All states ensure Indigenous suicide prevention strategies are fully implemented to reduce youth suicide in Indigenous communities. Thank you, Madam Chair.
Thank you very much for your statement and the important, drawing on the important linkage between education, intervention, prevention to ensure Indigenous cultural integrity. I appreciate your comment and your specific recommendations. The next speaker is Ms. Tanya Rush.